Hello, I'm James Fitzgerald. I hope you're following along with this series of videos and you understand everything so far. We are on the third video in a broader series of 8 videos. Please note, this video is meant exclusively for potential clients, new clients, and existing clients. This video is educational and informational. It is not meant to replace professional mental health care. It is an outline of therapy. It is not meant to be therapy. I'd like to continue bringing you through a comprehensive overview of my therapy program and the process of developing your treatment plan. In this video, we'll be looking at the preliminary screening and assessment stage of therapy. Assessment and diagnosis play a critical role in understanding your unique needs. We will work together to complete any necessary assessments and screenings, with interviews, surveys, and questionnaires. This way, we are ensuring that I have a clear and accurate understanding of your challenges. This allows us to tailor your plan, ensuring that it addresses the specific issues and challenges you're facing. During the assessment and diagnosis sessions, we will explore your behaviors, emotions, and attitude toward me and toward therapy. The information I gather will be used to support your journey toward mental health and wellness. First, I will prioritize understanding your unique experiences, sensations, thoughts, and emotions. This understanding allows me to accurately assess the specific aspects of your primary and any co-occurring DSM diagnoses. By carefully evaluating your behaviors, emotions, and attitudes, we can determine the most relevant DSM-5 specifiers, which are critical in tailoring your treatment plan to your individual needs. In addition to informing diagnosis, this comprehensive assessment process guides the creation, implementation, and ongoing revision of your plan. It helps us track treatment outcomes, ensuring that the approach to therapy remains effective and aligned with your evolving goals. Your input is essential as we continuously adjust your treatment to best support your progress. By understanding the nuances of your experiences, we can identify the most appropriate therapeutic interventions, which are key to achieving meaningful change. Moreover, this information helps us build rapport and strengthen the therapeutic relationship, creating a safe and supportive environment for your healing. Throughout therapy, we will assess your level of insight into the challenges you are facing. We will explore whether you perceive these issues as problematic and how motivated you are to address them. Another way of looking at your motivation and openness is through the trans-theoretical model of the stages of change. The stages of change are pre-contemplative, contemplative, planning, action, maintenance, termination, relapse, and remission. We'll be concerned for now with the pre-contemplative, contemplative, and planning stages. You might demonstrate good insight, recognizing the problematic nature of your behavior and being motivated to work on change. You are probably in the contemplative and planning stages, getting ready to move into or moving into the action stage. Alternatively, you may feel ambivalent, acknowledging the problem but feeling reluctant to address it. You are probably in the contemplative stage. In some cases, you might resist acknowledging the problem altogether, feeling unconcerned and unmotivated to change. You're probably in the pre-contemplative stage. Understanding where you are on this spectrum helps us tailor our approach to meet you where you are. One of the aims in the beginning sessions of therapy is to guide you through the pre-contemplative and contemplative stages, until you are ready to move into the planning and action stages. It is also possible that by joining me in these first sessions, you have already moved into the planning and action stages. This is the point in the process when mental capacity is a contributing factor on whether we can proceed at all with therapy. Mental capacity is the primary necessity for a person to be able to provide their informed consent to treatment. Please watch my video about mental capacity and informed consent to learn more. We will also assess for any research-based correlated disorders, such as vulnerabilities to suicide, when appropriate. During the formulation of your plan, it's important to consider factors like age, gender, and culture, which can influence your behavior and offer insights into your current challenges. By considering these factors, we can develop a more comprehensive understanding of your situation. Another important aspect of our work together is assessing the severity of any impairments in your daily activities of life functioning, whether in social, financial, relational, vocational, interpersonal, intrapersonal, or occupational domains. Understanding the impact of your symptoms and behaviors helps us determine the appropriate level of care. As your treatment progresses, we will continuously assess the severity of these impairments and the effectiveness of our interventions. Our goal will be to help you move from severe impairment to a place where the problem causes only mild or moderate difficulties, or better yet, no difficulties at all. One crucial objective in our work is to discuss any current or past use of alcohol or substances that may contribute to or complicate your treatment. This is an important part of understanding the full picture of your health and well-being. I will not be able to participate in a therapy session with you if you are intoxicated or impaired with drugs or alcohol. If it is determined that you need a higher level of care due to mental health crises or substance abuse, we will assess this using the criteria from the American Society of Addiction Medicine and the Substance Abuse and Mental Health Services Administration. If necessary, we will arrange for a referral to a substance abuse evaluation, and based on the evaluation's recommendations, refer you for the appropriate level of care. This might include intensive outpatient programs, residential treatment, rehabilitation, or inpatient care. We will now talk about the final part of an initial assessment, your strengths, needs, abilities, values, and preferences. These elements, your strengths, needs, abilities, values, and preferences, are essential in shaping a treatment plan that's tailored just for you. First, let's talk about your strengths. One of the most important strengths you bring to therapy is your resilience. If you've shown an incredible ability to bounce back from challenges, that's something we're going to lean on as we work together. Alongside resilience, if you have a growing sense of insight into your own thoughts and emotions, that will be helpful. Self-awareness is a powerful tool, and we'll be using it to dig deeper into understanding the patterns that might be holding you back. Another strength you might possess is your motivation for change. If you're here because you're committed to making positive changes in your life, congratulations. That commitment is going to be the driving force behind our work. You might also have supportive relationships, whether it's family, friends, or a community. These connections are invaluable, and we'll explore how they can support you through this process. Lastly, your adaptability, the willingness to try new things, will be key as we explore different strategies and techniques in therapy. Now let's consider your needs. One of the areas we'll focus on is emotional regulation. Developing the skills to manage intense emotions, especially during stressful times, is crucial. We'll work on building a toolkit of coping strategies to help you handle anxiety, depression, or any other challenges you're facing. Another important need is to work on self-esteem, building up your self-worth, and addressing any negative self-concepts or limiting beliefs that might be undermining your growth. Communication is another area where you might need some support. Expressing your needs and emotions clearly and effectively can transform your relationships, both personal and professional. We'll also focus on establishing healthy boundaries, which are vital for protecting your emotional well-being and ensuring that your relationships are built on mutual respect. Moving on to your abilities, if you have a solid foundation in problem solving, we'll build on your existing skill set to address the challenges in your life. if you're capable of practicing mindfulness, staying present in the moment, we'll nurture this ability through mindfulness-based interventions. A strong sense of empathy is another ability that will serve you well in therapy. It can deepen your connections with others and help you develop more fulfilling relationships. We'll focus on your ability to set realistic and achievable goals, which will be central to making progress in therapy. Finally, reflective thinking, your ability to look back and learn from your experiences, will be a valuable tool in our work together. Your values are the principles that guide your life, and they're going to play a crucial role in our work. If you value personal growth and self-improvement, it aligns perfectly with the goals of therapy. If you also value authenticity, being true to yourself, our work together will support you in aligning your actions with who you really are. If meaningful connections with others are also important to you, we'll work on enhancing your interpersonal effectiveness to build those deeper, more fulfilling relationships. If balance is another key value for you, whether it's work-life balance, emotional balance, or finding a balanced approach to problem solving, this will be an important focus in therapy. Lastly, if you value compassion both for yourself and others, we'll integrate this value into our sessions, especially as we explore self-compassion practices. Finally, let's talk about your preferences. You may have a preferred approach to therapy, whether that's a holistic, evidence-based, or another style. I will make sure our sessions reflect that. You might prefer sessions that are more structured or perhaps more flexible, goal-oriented or exploratory. The structure of our time together will hold fidelity to what works best for you. Homework assignments can be an important part of therapy, and I want to make sure they fit your lifestyle. Homework is the work I might ask you to work on between sessions. Whether you prefer weekly tasks, reflection-based activities, or skill-building exercises, we'll find the right balance that reinforces the work we're doing in our sessions. Your learning style will be used to teach you new skills and knowledge, whether it is reading, listening to ebooks, or watching videos. I will respect your preference and offer multiple learning tools. The pace of therapy is also important. Some people like to take things slowly, others prefer a more accelerated pace. We'll move forward at a pace that feels right for you, allowing you time to process and integrate what you're learning. That concludes this third video on my program. Thank you for taking this time to gain a deeper understanding of therapy and treatment plans. In the next video, I'll review the formal assessment and diagnosis stage of therapy. Please subscribe to the channel if you haven't already. I'm posting new videos every day. See you soon.